Hi, everyone. My name is Adam Kahn, and I am a third-year medical student at Oklahoma State University Center for Health Sciences. I am excited to share the findings of our study titled Discrepancies in Safety Reporting for Chronic Back Pain Clinical Trials, an observational study from clinicaltrials.gov and publications. So, chronic back pain is one of the leading causes of disability worldwide, affecting millions of people daily. Its management includes pharmacological, non-pharmacological, and procedural interventions. However, the safety of these treatments relies on accurate reporting in clinical trials, specifically the accurate reporting of adverse events, such as serious adverse events, other adverse events, and treatment-related withdrawals. Our study set out to examine discrepancies in adverse event reporting between trials registered on clinicaltrials.gov and corresponding publications, because inconsistent safety data can pose significant challenges to clinical decision-making and may obscure the true risk profile of treatments. We conducted a retrospective analysis of phase 2 through 4 randomized control trials on chronic back pain registered on clinicaltrials.gov from 2009 to the end of 2023. We chose 2009 as our start date because that is when mandatory adverse event reporting by federal agencies took effect. Our data set included 114 trials, of which 40 had corresponding publications. We compared safety data such as serious adverse events, other adverse events, mortality, and treatment-related withdrawals between registry entries and publications. Our findings revealed some pretty alarming discrepancies in adverse event reporting between clinicaltrials.gov and publications for chronic back pain. These inconsistencies are more than just statistical anomalies. They represent critical gaps that can impact clinical decisions, patient safety, and the overall trustworthiness of published research. So let's break our results down a little bit further. In our study, 80% of publications underreported SAEs compared to their corresponding registry entries. This is particularly concerning because SAEs represent the most critical safety outcomes, such as life-threatening events or those requiring hospitalization. If healthcare professionals rely solely on these publications, they may inadvertently underestimate the risks associated with the treatment, leading to potentially harmful decisions. As far as OAEs, we found discrepancies in other adverse event reporting in 92.5% of publications. Some publications reported more adverse events than registries, while others reported fewer. This inconsistency not only obscures the true safety profile of treatments, but also complicates meta-analysis and systematic reviews, which depend on accurate data for evidence-based recommendations. One of the more concerning findings in our study was discrepancy. In 37 was discrepancy in death reporting. In 37.5% of trials, publications reported deaths that were not reflected in clinicaltrials.gov. These omissions or additions without proper clarification create a fragmented understanding of treatment risks. As far as treatment-related withdrawals, we found that in 40% of trials, discrepancies were noted in the reporting of participant withdrawals due to adverse events. Publications were more likely to report higher withdrawal rates than registries, suggesting that it could be possible that trials might be underreporting these figures to maintain a favorable safety profile. So why does all of this matter? These findings emphasize the broader issue of selective reporting, where the choice of what gets published can skew perceptions of safety. This has implications not only for clinical practice, but also for regulatory decisions, insurance coverage, and even patient willingness to undergo certain treatments. So how can we address this issue? To address these challenges, we can advocate for adopting consort harm guidelines. This standardized framework provides clear instructions for reporting adverse events, which can ensure transparency and consistency. We can also require linked registry data. Journals can mandate that authors include links to clinicaltrials.gov entries, allowing readers to verify data. We can also advocate for implementation of post-publication addenda. If discrepancies arise or data are updated, journals could require authors to issue addenda for clarity. By improving reporting practices and fostering accountability among researchers, journals, and regulatory bodies,